What is borderline personality disorder, also called BPD? A personality is comprised of enduring traits and characteristics that define the individual's behavior, emotion, and thinking patterns. A personality disorder is a mental health condition characterized by inflexible and maladaptive patterns of behavior that cause significant distress or impairment in functioning. In the following thesis, we will examine the cause and symptoms of borderline personality disorder, one of the most common and devastating personality disorder, the nine symptoms of BPD, frantic efforts to avoid real or imagined abandonment, unstable and intense relationships characterized by idealization and devaluation, identity disturbance, impulsivity in at least two areas that are potentially harmful to the subject, like impulsive spending or addiction, recurrent suicidal threats, gestures, and self-harming behaviors, emotional instability or frequent mood swings, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, transient stress related paranoid ideation, psychosis, or disassociation. History of the term borderline. Initially, the term borderline was used for patients who were neither psychotic nor neurotic, people considered on the border between sanity and insanity. In the 60s, the term borderline was used for the first time for patients with high level of impulsivity, severe mood swings, fear of abandonment, and anger issues. In the 80s, borderline personality disorder was for the first time included in the DSM. Kernberg theory. According to Kernberg, the psychic functioning of the individual with VPD is characterized by a weak sense of self, very strong aggressive drive coupled with primitive defense mechanisms such as splitting and projection. Identity diffusion. Splitting is a defense mechanism in which a person sees things in black and white terms, viewing people or situations as either all good or all bad, without acknowledging any gray areas in between. Projection is a defense mechanism in which a person attributes their own unwanted or unacceptable false feelings or behaviors to somebody else. Identity diffusion is the lack of a clear sense of self. Marshallinian biosocial model. According to Marshallinian, BPD is caused by emotional dysregulation, also called emotional vulnerability, characterized by experiencing emotion particularly intensely, a slow return to the normal baseline once upset, dramatic and intense reaction to distress. Another characteristic of BPD is black and white thinking, dichotomous thinking. DiMaggio and Semerari theory. The elements that constitute BPD according to DiMaggio and Semerari are emotional dysregulation, dysfunctional beliefs about oneself, the unworthy self, and the vulnerable self. The unworthy self is the belief that one's personality is unlovable and worthless, grotesque, or evil. The vulnerable self is the belief that one is particularly vulnerable and defenseless. These beliefs, coupled with emotional dysregulations, lead to very painful emotional states. Liotti, in addition to agreeing with the most important elements of the theory we explored previously, also highlighted the importance of the dramatic triangle. The concept of the dramatic triangle refers to the dynamic of shifting roles between victim, persecutor, and savior. People with BPD constantly see themselves and others in these roles, leading to unstable relationship with others. Aaron Beck's theory. According to Aaron Beck, people with BPD suffer due to emotional dysregulation and from three dysfunctional core beliefs: the belief that they are particularly vulnerable, the belief that the world is dangerous and hostile, the belief that they are unworthy of love and worthless. Due to these beliefs, people with BPD find themselves in a dilemma impossible to solve. They seek closeness and protection because they see the world as hostile and dangerous, but they push away their loved ones because they don't think they are deserving of love. The role of childhood trauma and genetic. BPD is caused by genetic predisposition to impulsivity and emotionality, and a childhood spent in an invalidating or traumatic environment. Often, individuals with BPD develop a disorganized attachment toward their primary caregiver. Children develop a disorganized attachment when they seek love and protection from a threatening caregiver. Previous. Borderline personality disorder affects between 1% and 5% of the general population. 10% of people with BPD die by suicide. 10 years after first seeking treatment, most patients are in remission. 75% of people diagnosed with BPD are females. Males with BPD are often more aggressive, while females tend to self-harm and internalize more. Several studies Several studies have shown that people with BPD have a tendency to systematically interpret neutral facial expression as aggressive or hostile. Brain scans have shown that people with BPD have abnormal amygdalas and infralobe. These are brain areas that have a crucial role in processing emotion and impulse control. The protagonist of Sharp Objects, 30-year-old Camille Trickers, who were mood swings, fear of abandonment, rejection, self-harm, and alcoholism, is a very realistic cinematic portrayal of this condition.